This is a presentation of Dr. Michael Murray on COVID-19. He's widely regarded as one of the world's leading authorities on natural medicine. He's a graduate faculty member and serves on the board of Bastyr University in the States. He's co-author of a textbook of natural medicine and has written 30 other books, including one that he's just brought out called The Longevity Matrix. So Dr. Murray, over to you, and please introduce any other aspects of your extraordinary career.
Well, thank you. It's all about trying to help people improve the quality of their life through natural health and using natural measures. And I'm really excited about this, this topic. I'm going to get right to it. I've got a lot of material to share and more information than time. So I know I'm speaking to a very educated crowd, so hopefully everything will go at a really good pace. So here's what I'm going to cover. I'm going to cover where did this virus come from, what increases the risk of infection, why do some healthy young people suffer severe infections, what are some critical recommendations to defend against being infected by this virus, and then we'll have some time for some question and answers. And let me get to this this first aspect, and that is, you know, where did this virus come from? It's an answer as well. So let's get to it. Where did this virus come from? Well, we know that coronaviruses thrive in bats, and the consensus is that this is the transfer of a coronavirus inherent to bats to humans. But where exactly did that transfer occur, and when did it occur? And the best evidence is that this was a result of gain-of-function research by virologists at the Wuhan Institute of Virology. And it basically was the SARS virus that had been enhanced through manipulated mutations to produce SARS-CoV-2. I put a link here to a really nice article in Minerva about the validity of what I'm saying here. I think it's the best explanation of where this virus came from. And there are certain reasons why this virus is behaving like no other virus that we have come into contact with. And gain-of-function research is the best explanation for that. One thing that has really been highlighted in some of this research is the role that furin cleavage plays in helping SARS replicate. This is a highly infectious virus. It's in many respects the perfect human pathogen. And again, that was kind of the question that was being asked. How can a virus be more infective and have a high rate of mortality? And we found that answer. There are things that we can do, I think, that can significantly reduce both the infectivity and the mortality of this virus, but there's a lot that we don't know about it. What we do know is that there are certain risk factors, and these risk factors have been well publicized. Basically, people that have poor immune function, that means people that have not really taken care of themselves, who are suffering nutrient deficiencies, because nutrition is really the key determinant for many people of their immune status. We know that comorbidities are a big factor: being overweight, having diabetes, high blood pressure, chronic obstructive pulmonary disease, chronic liver disease, chronic kidney disease are all risk factors. I think certain medications are also risk factors: ACE inhibitors, PPIs, non-steroidal anti-inflammatory drugs, and even acetaminophen. I also think that the flu vaccine may be predisposing many people to a greater risk of infection and mortality. I'll touch on both of those. First question, do ACE inhibitors increase the risk of COVID-19? There's a link. We see this link of high blood pressure. Well, this link with high blood pressure may be the result of the role that these drugs, ACE inhibitors, play in increasing the number of ACE2 receptors on cells. This is the portal, this is the vehicle of infectivity of that SARS-CoV-2 virus. We also see that proton pump inhibitors are linked to this virus as well. The level of gastric acid is critical in determining the risk of infection. If we have low gastric pH, that virus can't survive and is destroyed in the stomach. If it passes into the small intestine, then it can be a pathogen. It can be an infective organism. And the gut is the secondary entry point of this virus. Not only the respiratory tract, the primary route, but the gut is a big factor. And the rate of clearance of this virus from the gut is much slower than the respiratory tract. Once it clears the respiratory tract, it's anywhere from 30 to 40 days before it's clear from the gut. So it seems to persist in the gut a lot longer than in the respiratory tract. I think not only is stomach acid a role in this increased infectivity, but also the lack of digestive enzymes. So that's just something else to consider. What about non-steroidal anti-inflammatory drugs and acetaminophen? Yeah, these are not good drugs for this virus. Brings into question, is reducing a fever a good idea? And the answer appears to be no. Certainly if it gets to a dangerous level, we need to bring it down. But I think non-pharmacological measures are a better approach there. We know that non-steroidal anti-inflammatory drugs are known to worsen COVID-19. Why? I think it's not only the fact that it's lowering the fever. I think it increases gut permeability and may increase the transfer of that virus from the gut systemically. Acetaminophen is known to slow down viral clearance. Acetaminophen could be catastrophic due to depletion of glutathione, which is the main antioxidant in the cells throughout the body, including the lungs and including the intestinal epithelial cells. This is a good article that gives you an idea of how important glutathione is, and it's a great title. Endogenous deficiency of glutathione is the most likely cause of serious manifestations and death in COVID-19 patients. Pretty clear what the link is, and that link is explained in this article. And you all know how we can go about boosting glutathione through diet and supplementation, but we also know that acetaminophen is just catastrophic to glutathione stores. So again, I think staying away from Tylenol and related drugs is really important. I mentioned this controversial subject about the flu vaccine possibly increasing the rate of COVID-19. If you look at this study that was published early in 2020, it's kind of a clue that maybe these super flu vaccines are not such a good idea, because they may create viral interference and increase the risk for developing other viral infections. In the key findings in this study, this is a non-political study. This was done in U.S. Members of the Department of Defense, and they looked at vaccinated versus non-vaccinated, and they showed that the vaccine-derived virus interference was significantly associated with increased risk for developing coronavirus infection. Now, this isn't COVID-19, but it is a coronavirus infection risk factor, and I think that will likely be shown to be true. And I think that there's a lot of emerging data calling into question how effective and safe flu vaccines are. And here we are getting ramped up to develop kind of a global vaccination program for COVID-19, and it may be of a Trojan horse. We may reduce the risk of COVID-19, but we may increase the risk of other viruses. So there's a lot of questions about the validity of the effect of vaccines, particularly in high-risk individuals. And the answer seems to be they're not really that effective. And what we're dealing with now in a lot of countries is not just the typical flu shot. They're using adjuvants to greatly increase the immunogenicity of the response. And I think it's a factor. We also have other factors that could explain why there was an increase in mortality in some countries like Italy. Could be more lethal mutation of that virus. But I also think there's some smoking guns showing that we could see a link between different vaccines in different countries being associated with the difference in mortality rates. So was the flu shot that was given to Germans this year different than the ones that were given in Italy and Spain? Could that be a factor? Because they're fairly close geographically. Why the difference in mortality? I think it's just something that needs to be looked at. A lot of factors to consider here. Why do some healthy young people suffer severe infection? This is very rare, but it does occur. It could be genetic factors, but I think nutritional factors are a key thing. I also think the level of viral exposure. I was recommending wearing a mask from the very beginning of this pandemic because it just made sense. We want to reduce the inoculum level. There's always a race between our immune system and the virus. And if we are exposed to a high dose of that virus, we're giving it a head start. So the key may be getting exposed to a very small dose of this virus. And that may be the reason why most healthy people, when they're exposed to this virus, don't have any symptoms. But even a healthy person that's exposed to a large dose of this virus, it could be fatal. So I think not enough attention has been given to the load of viral exposure. So just something for you to consider. Bottom line is we don't want to get this virus and we don't want to be exposed to it. But if we are going to be exposed to it, we want that dosage to be as low as possible. There's also been a lot of discussion as to why do these antibodies disappear? People get infected, and whether they have symptoms or not, many people, after a few months, there's no detectable antibodies. Where did those antibodies go? I think this is a clue, and here's what I think it's telling us. One, I don't think humoral immunity or antigen antibody-related immunity is a big factor in this virus. I think what's more important is cell-mediated immunity. And you know the differences. Cell-mediated immunity is going to be able to kill that virus intracellularly. Humoral immunity works mainly when that virus is outside the host cell. So T-cell mediated immunity may be more important. Here's a good article. It just came out July 7th. It's good to read because it highlights how important T-cell mediated immunity is in this infection and against this virus. So we'll talk a little bit about enhancing cell-mediated immunity. This is a great example, this virus, of the importance of the infection equation. In the infection equation, the interaction of the host immune system with the infecting organisms determines the equation's outcome. Weak immune system plus highly infectious virus, severe disease or death. Strong immune system plus highly infectious virus, less severe to no disease. This is a just a classic example how we need to focus on the terrain and the immune system and not just how infectious this organism is. I think when we're looking at immune function, we have to look at the 4 cornerstones of good health: a positive mental attitude, a health-promoting lifestyle, getting enough sleep, exercising, avoiding harmful health habits, all critical. Eating the nutrients that we need through our food and through supplementation is important, critical to immune function. Nutritional status is the biggest determinant of immune status. I'm a big fan of the traditional Mediterranean diet. I make some modifications. I get rid of those complex carbohydrates and sugars. We can utilize good sources of carbohydrates to get those nutrients. Pasta, rice, polenta, potatoes, breads, these are kind of less nutrient dense and are just not providing the same sort of nutritional support as other carbohydrate sources, mainly vegetables, legumes, and fruit. So let's get rid of those empty calories, focus on good whole food. You all know the components of the immune system. I'm just going to highlight important characteristics for good immune function. First line of defense is the physical barriers that viruses and bacteria must cross: the skin and mucous membranes that line the digestive, respiratory, and reproductive tract. A lot of anti-infective properties exist at those barrier levels, and they don't have anything to do with immunity. In many cases, when they do, they are of the non-specific nature, the innate immune system. And this is highlighted by the second line of defense. So the innate immune system is really important in fighting against this organism's severity. You're going to reduce the systemic effects. You're going to neutralize that virus before it gets in and really starts wreaking havoc. So we want to make sure we have good macrophage, neutrophil, natural killer cell, dendritic cell function. We want to make sure that cytokine levels are being supported, but they're not excessive, and I'll make some mentions of that. The third line of defense, this is our adaptive immune system. And so we have basically B cells that are involved in the humoral or antigen antibody mediated immune system. And then we have T cells that are regulating cell mediated immunity. And note here, 70% of the immune system resides in the gastrointestinal tract. So I think it's really important to take a look at gut permeability and gut function in our patients, and particularly paying attention to that right now to make sure they have maximum immunity. These are the underlying factors that contribute to decreased immunity. I've said it several times: nutrient deficiency, nutritional status, stress, insulin resistance, chronic inflammation, food allergies and intolerances, presence of a leaky gut, increased toxin exposure, and genetic predisposition. So all these factors have to be considered when we're evaluating a patient's immune function. You all know what the leaky gut is. I think it's a big factor explaining why many people have low immune function. This is showing you, as we move from left to right here, what happens when we have increased gut permeabilities. We have lots of cytokines and an inflammatory milieu, and we can block that. There's a lot of things that we can do in natural medicine to enhance these tight junctions, to prevent this inflammatory process and reduce that leaky gut. Great article here, World Journal of Gastroenterology from last year. That's where I lifted this illustration, and it goes into detail of a number of factors that can play a role in reducing gut permeability. These are the big causes of increased gut permeability: nutrient deficiency, food allergies, dysbiosis, and antibiotics. And not just antibiotics, other drugs disrupt gut permeability. I mentioned non-steroidal anti-inflammatory drugs earlier, and I think this is one of the key factors that are responsible for it increasing the severity of COVID-19. High sugar intake, overeating, the wrong types of fats, too much alcohol, poor digestion, all are other causes of increased gut permeability. I want to briefly mention how important thymus gland function is against this virus. Remember, we want to support cell-mediated immunity. The thymus gland is the master gland of the immune system through its action on cell-mediated immunity. It matures T lymphocytes, it produces thymic hormones, it controls cell-mediated immunity through various communicative factors with these thymic hormones. We want to enhance thymus function by preventing thymic involution. Antioxidants are really important in that goal. Supplementation with nutrient cofactors is also very important. These are the foundation supplements that I recommend for good health: the high potency multiple vitamin and mineral formula, extra vitamin D3. I got an asterisk there because blood testing can give you a more dialed in dosage, but in general, I recommend 2,000 to 5,000 IUs of vitamin D3. I like to recommend a plant-based antioxidant, a flavonoid-rich extract, quercetin perhaps, curcumin, some sort of greens drink, something that's going to provide broad-spectrum antioxidant effects. I think a good source of EPA, DHA, and DPA, 1,000 to 3,000 milligrams daily, is important for overall good health, and I think it's also important in regulating a proper immune response. So having the right types of fats may help prevent that cytokine storm. This is what people always ask me, what do you take? Here's what I take daily. This is what my 15-year-old daughter took before COVID-19. Here's what she's taking now. I'm laughing because, she's very compliant, and she gets it. And so I just bolstered her supplement plan with greater support for that immune system. And I'm kind of an extremist, I guess. I take a lot of things. I get them at a good price. I know their value. But even my 15-year-old daughter, I've got her on a very aggressive supplement program. I don't want her to fall ill, and I don't think she will. Their kids are low risk, but I'm taking even extra precaution by making sure she has all the ammunition that her immune system needs. So very important to provide high potency multiple vitamin and mineral, because any single nutrient deficiency can lead to significant impairment of the immune system. So we know that multiple vitamin and mineral supplement provides documented benefits in boosting immune function, particularly in cell-mediated immunity. It has other benefits as well. It just makes sense. Here are 7 key nutrients for immune function. I think vitamin A may have to be taken separately. Most multiples have replaced retinol with beta carotene. Retinol exerts more significant antiviral effects and has greater effects on barrier function. So I'll give you my range for vitamin A supplements in just a minute. Beta carotene and other carotenoids are very important for supporting thymus function. Vitamin D, vitamin C, B vitamins, zinc, and selenium. These are the 7 key nutrients. The vitamin A against viral illness is well known. Vitamin A was given that name A, not only because it was the first vitamin, but because it shows direct anti-infective properties. Is the anti-infective vitamin. Vitamin A supplementation is known to decrease the risk for mortality and morbidity from infectious diarrhea, measles, RSV, HIV, and malaria. I think if they ever got around to studying it, we'd see the same sort of relationship with COVID-19. Vitamin D's gotten all the press right now, but I think vitamin A is also critical to immune function and critical in this virus. So prevention, 3,000 micrograms, 10,000 IUs for men, 5,000 IUs per day for women. It is a teratogen, so women of childbearing age need to be very careful and certainly should not take more than 5,000 IUs a day. And that includes even when they're suffering from an acute infection, we want to go to a higher dosage. You can see that I ramp up this higher dosage, single oral loading dose. I'll leave it to your critical judgment as to whether you want that to be a single dosage or may elect to go with this dosage for 3 days. For the general public, I'm saying once, but for practitioners, I would say 3 days. If you feel comfortable with the patient, they've got good liver function, you're not worried about vitamin A toxicity, they're not pregnant, I would do it for 3 days. Vitamin D, we know it has very good effects on immune function. You all are familiar with that. High quality evidence shows vitamin D3 supplementation reduces the risk of developing respiratory tract infections. This study that was done in Australia is a good example of that. It was a small study, but it was, I like showing it because they gave either a placebo, 800 IUs per day of vitamin D, or 2,000 IUs of vitamin D. And you can see that the higher dose produced the greatest effect. There was only one subject had a cold or influenza symptom with the high dose of vitamin D3, 2,000 IUs per day. That's the low threshold dose for my recommendations. You may have seen this study. This was a study that was done by Grassroots Health. It was, I think, in the Philippines. You're looking here at blood levels of vitamin D3, and we can see that when levels are below 30, there's a much greater risk of having symptomatic COVID-19, and the severity will increase, usually parallel to the severity of the deficiency. And look at this, in patients that had greater than 30 nanograms per ml, or greater than 75 nanomoles per liter, mild or no symptoms at all. So we want to have optimal levels of vitamin D3. So certainly above 30, optimal probably 50 to 90 in this time. So how much blood levels are critical, but I would say a loading dose, 10,000 IUs daily for 3 months, followed by 5,000 IUs daily with no sun exposure, 2,000 IUs with some sun exposure. And then I like to give a plug to the Vitamin D Council. Go to the Vitamin D Council and stay up to date on vitamin D research. Zinc is the gatekeeper of the immune system. It's involved in every aspect of immunity, especially thymus function and hormones, white blood cell function and signaling in our innate immunity, as well as it does exert direct antiviral actions. It inhibits viral replicase. Some of the benefits that have been noted with some antimicrobials, antiviral agents, may be due to zinc acting as an antiviral agent. So natural zinc ionophores, those things that increase the ionic form of zinc in infected cells. Quercetin is the big one. Other flavonoids may play a role. These are my dosage recommendations: 30 to 45 milligrams for men, 20 to 30 milligrams. And side note, is the loss of taste and smell in COVID-19 due to an induced relative zinc deficiency? I think you can make a very strong claim for that. Flavonoids, I love flavonoids. They're just nature's little miracles. As a class of compounds, they exert biological response modification. These are the pharmacological actions: antioxidant, anti-allergy, anti-inflammatory, antiviral, anti-neoplastic. There's been a lot of focus on black elderberry. Flavonoids may or may not be the chief antiviral compounds. I think not, but that's more a longer discussion. There's other compounds in elderberry that I think are likely responsible for the antiviral activity more so than the flavonoids. I think a high flavonoid diet, no question, exerts significant anti-infective effects, and these are some common food sources, and all of these different flavonoids have benefits. I'm going to talk a little bit about elderberry really quickly. It's very modest in its effects. I think it's really quite popular right now, more based on marketing and kind of a wave of popularity than it is with science. If we look at one of the better studies with elderberry extract, and this was a flavonoid-rich extract, so we have some dosage criteria. The dosage provides 90 to 135 milligrams of these anthocyanins. So a good healthy dosage was shown in this study. You can see that they took the supplement before they went on their trip. Then they took a long flight, 12 to 14 hour flight, and then they continued to take the supplements when they got to their destination. The overall results show that when people did catch a cold, the duration was about 2 days shorter, and they would exert signs of improvement by reduced symptom severity. So the key point I want to make here is that the rate of infection didn't differ. The same number of people got sick in the treatment group as the placebo group, but those that were taking the elderberry had shorter duration and reduced symptoms. But it doesn't block infection. I'm going to talk about quercetin, and I think quercetin may be a better choice compared to black elderberry as a prophylactic in COVID-19. So we know that these anthocyanins are very poorly absorbed. So I don't think they're the real active components. And what if the active antiviral components of elderberry were not the anthocyanins? Well, we see that they have these low molecular weight proteins known as ribosome activating proteins and hololectins. And I'm chuckling because these are filtered out in the production of the extract. So some of those more crude syrups and berry preparations may be more beneficial because they contain these antiviral compounds. It may not be the anthocyanins. I don't think it is. I think it's these other compounds. So a lot of questions to be answered about elderberry. Let me answer some questions about quercetin. Quercetin, I think, is a better choice. Why? Well, because we have some interesting clinical documentation along with some in vitro effects. The in vitro antiviral effects, we know that quercetin binds to SARS-CoV-2 spike protein docking station on ACE2 receptor, so that will block infection. We know that it acts as a zinc ionophore. Now, there's a question about the absorption of quercetin. So let's talk about the commercial available forms of quercetin. Quercetin, EMIQ, and quercetin phytosome. So let's talk about regular quercetin. it works. Quercetin dosages of 1 gram per day was shown to improve athletic performance, but look at this statement: reduces upper respiratory infections in moderately trained individuals. Only 1 out of 20 developed symptoms in the quercetin group, compared to 9 out of 20 in the placebo group. So quercetin exerts some anti-infective effect, and is probably due to direct antiviral activity. Quercetin is poorly water soluble. It's hard to absorb. It's quickly degraded by bacteria. It's rapidly metabolized and has extensive first pass metabolism. So it has low bioavailability. There are 2 forms that bypass this poor bioavailability. One is called enzymatically modified isoquercitrin. This is it's kind of similar to rutin, but it's a little bit different. And basically, this EMIQ is cleaved into quercetin by epithelial cells, leading to the absorption of quercetin in blood levels. The total AUC increases 15x with EMIQ compared to regular quercetin. So quercetin is enhanced with IQ use. So if it's 15 times better absorbed, let's just say 10, just to keep it's simple, 100 milligrams would produce the same benefits as 1 gram of quercetin. Quercetin phytosome, I'm a big fan of phytosomes. These are produced by a company out of Italy called Indina. Quercetin phytosome, which utilizes phosphatidylcholine, and that is actually used to bind the quercetin to form a complex, and that leads to better absorption. And quercetin phytosome is up to 20 times greater absorbed than regular quercetin. So 50 milligrams of quercetin as a phytosome may be equal to 1 gram. So better absorption, generally better results, but we can also maximize the quercetin that's being used. So this is showing you at the lower dose, it's 10 times better absorbed than regular quercetin, and these are the blood levels that we see, plasma levels that we see with quercetin, low dose quercetin phytosome, and the 500 milligram quercetin phytosome. So the dosage, if we want to use quercetin, 1,000 to 2,000 milligrams per day, EMIQ 75 to 150, quercetin phytosome 125 to 250, and that will, the 250 will provide 100 milligrams of quercetin. So selenium. Selenium is something that I think is undervalued as an immune enhancer, but it's absolutely critical. 200 micrograms per day has been shown to stimulate white blood cells and thymus function in selenium deficient individuals, and selenium supplementation to individuals with normal selenium levels has resulted in significant increase in the ability of white blood cells to kill tumor cells, and an 82% increase in natural killer cell activity. Natural killer cells, part of our innate immunity, they are non-specific. They recognize viruses and they kill them. They recognize cells that have been infected by viruses and they kill them. So very important for natural killer cell function to be improved in this protection against COVID-19. I like SelenoXcel. SelenoXcel is a high selenium content yeast. The research with this form of selenium far superior. The yeast is inactivated. It is rich in beta-glucan. These are important immune enhancing components of yeast and yeast products. Clinical results with SelenoXcel show better results in protecting against oxidative damage, better results in boosting immune function, and the nutritional prevention of cancer study showed a 50% reduction in cancer mortality with SelenoXcel supplementation. Some of the newer studies with just regular selenium or selenomethionine, not effective at all, and may actually show in some studies to increase the risk of certain forms of cancer. So I'm going to switch. I want to just quickly talk about some additional natural products. I mentioned the beta-glucans. I like Wellmune. It's the most well-studied source of beta-glucans. It's derived from a unique type of baker's yeast, and it's different in its beta-glucans compared to bacterial beta-glucans or those found in mushrooms or those found in grain. The beta-glucans in Wellmune, they act to prime our immune system. They literally bind to white blood cells and activate them in a way so that they can do their job and be alert and ready to respond. When consumed orally, Wellmune is taken up by macrophages, and it acts as a pathogen-associated molecular pattern activator. So again, it's just activating the immune system to be alert. It's not a stimulant per se. It's just saying, hey, there's something going on here. Pay attention, be ready to respond. Wellmune is well studied, been the source of many clinical studies. This is a summary of these studies, all showing some pretty significant benefits. Reduction in symptom severity, decrease in upper respiratory tract infections, some of them quite significant, increased salivary IgA levels by 32%, so activating our non-specific immune system. Again, additional studies, so well-researched. I like this study, the California Marathon study, 67% reduction in the number of individuals reporting upper respiratory tract infections. So again, my impression of Wellmune is that it's able to protect against infection. We're not talking about reducing severity and symptoms. We're talking about preventing the infection in the first place. How does it do that? By activating that innate immune system. So that's that PAMP activity. Here's the result of that study, looking at the ability to reduce upper respiratory tract infections by 71%. There's so many natural products that we can highlight looking at their effects on immune system, but pay attention and get a sense, because some of the results are not that impressive. If you reduce symptom severity by 20%, if you reduce the duration of a cold by 20%, clinically, I don't think it's that meaningful. Wellmune produces clinically relevant effects, very safe. It's being added to infant formulas in many countries throughout the world, very safe for kids. This is a study in children showing that children taking Wellmune can experience significant reductions in upper respiratory tract infections. So this is something I would encourage for parents to be given infants and children of all ages. I think this is a great immune enhancing product. Typical dose for adults, 250 to 500 milligrams a day. Just with kids, I think it was 75 milligrams per day. That's that's a dosage I would recommend. But adults, 250 to 500 milligrams per day work very, very well. I've got other things that I would talk about. I'm just going to skip over this one and talk. I'm going to end by talking about N-acetylcysteine. Very critical, I think, really important against SARS-CoV-2. Remember, glutathione status is a key determinant of the severity of COVID-19. It could be the difference between life and death. N-acetylcysteine replenishes glutathione stores, also has some effects on its own. It's a mucolytic. It is very important in keeping the airways clean. For mild to moderate conditions, 600 milligrams per day is a prevention as well. For more severe conditions and COPD, 1,200 milligrams per day, divided dosages seem to work best. me quickly review its effects on the mucus in the respiratory tract. It improves the rheological properties of mucus, helps it to flow better. It reduces excess mucin production, and it's really part of the consideration both in a prophylactic measure and as a treatment measure in COVID-19. It enhances immune system, has some direct antimicrobial activity. It destroys biofilm, very good effects on regulating the cytokines, may help prevent that cytokines storm. This slide is showing you how it works. It works by breaking those disulfide bonds. It basically replaces that protein with the cysteine, and restores the structure of the mucus, and leads to its degradation and elimination if needed. It also has some great effects on the intestinal epithelium. It's very important in the treatment of leaky gut. It improves energy production in the epithelium. It promotes improved tight junction protein expression. So this is something that you gotta think about for improving gut function. Lots of data. This is a summary of 13 studies in COPD. In these studies, the bottom line that I want to get to is that higher dosages produce better results than lower dosages. So let's up the dose. 1,200 milligrams per day, much better than 600. All right, that was a rapid pace. I hope people were able to keep up. What I'd like to do now is open the floor to any questions. I'm going to go first to some that are already in the chat box, and give our moderators a chance to offer more questions. So the first question is, thank you for mentioning the zinc ionophores. Do you think patients with a homozygous COMT SNP should avoid quercetin? No. It's impossible to avoid quercetin. It's ubiquitous. It's the A-glycone of all the flavonoids in our diet, and so I don't think it's. I don't want to lose the sight of the forest for the trees. I'm not worried about the COMT SNP and quercetin. The question is, do you know if rutin can serve the same purpose? I showed you that slide of EMIQ and its differentiation and absorption compared to quercetin. I also had rutin in there. Rutin is kind of metabolized extensively by gut bacteria. They feed on it pretty good. And the bioavailability of quercetin, which is the A-glycone of rutin, is not so good. So I think we're going to get different results with quercetin and those enhanced forms, the EMIQ and the quercetin phytosome. And by the way, we're going to see more enhanced forms of quercetin entering the marketplace as well. I know several companies that are looking at it and how we can improve its absorption. Similar to what we've seen with curcumin. We've seen a variety of different technologies to enhance the absorption of curcumin, which is another poorly absorbed, poorly soluble compound. So I think we're going to see those same sort of technologies and others with quercetin. Okay. I guess I should just keep on reading the questions from the chat. So let me read the next question. Masks have been made mandatory in shops here and are very controversial. I understand that where they may be viral load, that there may be some benefit possibly. Why are you so in favor? Many natural healthcare professionals are very anti-mask. I think vitamin D testing is essential, but are there any particular tests that you would prioritize. Let me answer the question on masks and why I'm pro-mask. I'm pro-mask because we don't have all the answers to this virus, and I'm very concerned about some of the things about this virus. It's different. It's different, and we don't know. We don't know whether it's people are going to harbor it like they harbor, some of the herpes family viruses. We don't know whether it triggers certain processes that lead to long-term health consequences. I think until we know more, we should take steps as individuals to dramatically reduce our risk. And I don't understand the anti-mask rationale. I have a friend, and he's constant because he's against he's against masks, so he's constantly sending me articles, and I agree with the articles. Masks are not 100% effective in preventing infectivity, but they do reduce infection rates, and they're just a rational approach to in my thinking. So if I'm not answering the exact questions, because I don't know what the rationale is from naturopaths that are against masks, because
well,
I think
I would just to come back on that. I mean, I read the evidence for and against, and instinctively I was quite against. And I think, from the point of view of my own health, but also from the point of view of let's just say other factors. But what was interesting is that I went on a plane. I flew to Greece the other day, and I flew back, and I had to wear a mask. And I felt so ill. I really did. And it really made me realize that actually, I think it has a detrimental effect. And I haven't seen evidence to say that I think the evidence is very weak for and against, to be honest. But I certainly felt that it was detrimental, and certainly raised my heart rate very significantly. I mean, that could have been just the anxiety of it.
No, I think you're rebreathing some of your air, and it is restrictive. I think that I like empirical evidence in this situation, and if you look at the countries that adopted early mask wearing, there was a lower rate of infection and a reduced mortality. My recommendation for wearing a mask is all about reducing that viral load. And I think the health effects that you might experience on a 3 or 4 hour flight or longer from wearing a mask pale in comparison to potential health effects of getting this virus. So you're kind of, when I weigh the pros and cons, I'm in favor of protecting ourselves from getting that.
That would be for everybody, not for people who are ill. I mean, if you're ill, it really, it makes sense.
Well,
the asymptomatic argument is another one, isn't it?
Well, when you're ill, we want to reduce, you're still going to have some particles coming out, but they're going to be reduced. But I want to protect, I want it to be a shield from people getting exposed to a big viral load. That's my rationale. And so some of the other arguments don't really come into play from my perspective, because they're not addressing this reducing viral load. I think when it's all said and done, and I think that's another empirical common sense. We all took microbiology, right? Remember with the Petri dishes, and we'd take our loop and we'd inoculate the Petri dish, and depending if we inoculated with a large dose of that bacteria, it would overgrow. So, I just think it applies to this virus especially. We don't want to give this virus a head start because, look at our healthcare providers. They can be really healthy, but if they're exposed to higher dosages of this virus, they can get sick and die.
Yeah, well, that is a setting which I would agree.
Yeah,
that's setting. I wouldn't disagree in that.
Yeah. There's I understand some of the rationale.
You just err on the side of caution, I guess.
I err on the side of caution because we don't know. We don't have, this virus is not acting like a typical virus, and there's reasons for that. I encourage people to read that article in Minerva. They looked at 4 characteristics of this virus that look to be manipulated, and they show the evidence of that. It's really, usually when we see mutations in nature, they're single nucleotide mutations. We don't see insertions of entire codons, and that's what it looks like happened here.
But then this begs the question of what we're testing, because there's obviously lots of debate around the testing.
The testing, yeah. I mean, if we're looking at the response, if we're testing the response, when we're looking at testing the response, particularly on immune function, we may not be looking at what's really important, because this is what makes the question of a vaccine so interesting. Because one, there's never been a vaccine commercialized for an RNA virus. This is an RNA virus.
Yeah.
2, the flu shot has never been shown to be effective, and it's just like it's a whack-a-mole. And so even though they may create something, how effective is it going to be, and what are the consequences? Is this going to be a Trojan horse? And this is I don't want to get off on a tangent, but that's my real concern about a vaccine, is what happens if we inoculate everybody with this vaccine, but it predisposes something that is usually not a big pathogen for us, and all of a sudden we've predisposed a huge amount of our population to something that can be catastrophic. So I'm a little concerned, and especially since we are bypassing animal testing. If you look at the animal tests that were the testing of the vaccines for SARS, there's a reason why we don't have a SARS vaccine, and it's called the results seen in animal studies. That's why we don't have a SARS vaccine. All this other these are other arguments that I've heard from virologists of why we don't have a SARS vaccine, never had a SARS vaccine, that doesn't hold water. Because if you look at the actual data from some of these vaccine studies in animals, what it produced, these vaccines against SARS produced a hyperimmune response. Okay, that's another way of saying the vaccines caused a severe cytokine storm, and it blew up these animals' lungs. What are we seeing in COVID-19? We're seeing a hyperimmune response that leads to a cytokine storm in the blowing up of the lungs. So anyway, let me get to some other questions, because there's quite a few here. The next question is a ketogenic diet to keep carbohydrates to a minimum.
So, sorry, Dr. Murray, I truncated that by mistake. A bit further down is the full one. Some practitioners are very keen on a ketogenic diet.
Yeah, I'm not. I think, Patrick Holford and I agree on this. We had some good discussions about this. I think there's some aspects of a ketogenic diet that are important. I think we need to avoid eating a high glycemic load diet, but restricting carbohydrate intake to less than 50 grams per day to produce ketosis is not a sustainable diet. It's just not. I don't think that's how our bodies were designed to function in the world. So it's going to lead to problems. And I think when you sacrifice the good carbs, the sources of flavonoids, carotenoids.
Yes, yes, I loved your emphasis on those. Absolutely.
Yeah, I just don't think it's short term. It might be a useful crutch or aid to kind of help restore blood sugar control, but I don't think it's a sustainable diet. I think when we get away from plant foods in our diet, especially, we put our health at risk.
Thank you.
Here's a question from, are there any long-term aftermath effects and systemic damage from this coronavirus compared to other coronaviruses? Absolutely. We're seeing evidence of chronic lung damage, and a lot of this damage is not, it's kind of an indirect effect of this virus. It's kind of the aftermath of the severe inflammation and some of the effects that this particular virus has on coagulation and clot formation. So my guess is we're starting to see additional problems, neurological effects, brain effects. I think this virus is going to have more systemic effects than any other coronavirus. Oh yeah, I'm answering the questions here. Here's a question. Do you know if there's any study or link to the recent deployment of 5G network? There was a abstract that was retracted. I wonder if you have seen any evidence in this direction. I don't think it's just 5G. I mean, we've all had the experience where we're looking where we have perfect phone reception, and you're thinking, how do these waves, how do they get to where I am? I mean, I've been underground 3 stories in an elevator and had perfect cell phone reception. I don't know if it's maybe there were some boosters or whatever, but think about it. What do we know about waves? They're both wave and particle, and we know that we are also waves and particles, and this confluence of all these waves and frequencies and photons and particles, or do they impact our health and our world? Absolutely. They are a factor. Do I think 5G is a factor in this pandemic? No. I think this pandemic is a result of a gain-of-function virus getting released out into the wild. And if you're not familiar with this term gain-of-function, virologists have been manipulating viruses for decades to see what happens when they have an increased infectivity or increased lethalness in their action. And these sort of research studies were outlawed in the U.S. for a couple of years, but they've resurfaced. And if we look at if we look at the history of activity of the Wuhan Institute of Virology, they've been knee deep in these gain-of-function studies for a long time, really heavily since 2012, and there's been concern about the potential catastrophic nature if one of these coronaviruses got out. And I think one of these coronaviruses got out. I think this is what SARS-CoV-2 is. And we're not getting a lot of information on this because the political and economic ramifications are significant. And what's interesting is that many of the virologists that are attesting that this is a virus that came from nature are the very ones that were leaders in gain-of-function research. No one wants to be responsible, to be held responsible for this pandemic, but I think we got to look at the likelihood of where this virus comes from and the cover-up to explain, try to explain where it came from. There's no question in my mind that it's through this gain-of-function research. Oh, yeah, this is a good question, and I want to touch on this. The death rates are falling, and the second rate is really what really just positive results from a test, which is well known for false positives and negatives. Here the UK deaths are not rising, and various data suggests this virus is not as serious as first thought. What is going on in the US? Many commentators cite 0.26 mortality based on CDC data. There's two variants of this virus that are well debated in the literature. One, D14 versus G14, and one is more infective, and the other is more lethal. And a virus isn't going to want to have a high mortality rate, because that means it needs a host. If it kills the host, it's not going to be able to find a new host as easily. So by nature, viruses tend to mutate to higher infectivity, but a lower morbidity and mortality. So I think that, again, this virus isn't behaving typically, especially in the way it's mutating, but it does appear that it is mutating in a way that lessens its mortality, and that could be a really good thing. I say could be because we don't know enough about it, and maybe it's mutating to become more infectious and cause more long-term health problems. We don't know, but what I do know is that since we don't know much about it yet, we should take every step we can to avoid it, hence wear a mask. So that makes my point again.
Thank you. There was one more question here a bit earlier. I'm wondering whether we could just look at that one. There was a lot of discussion in the early days of COVID-19 about the supposed promotion of cytokine storms ensuing from the use of some herbal remedies. Elderberry and echinacea were in the front line. Most herbalists agree this is a non-issue. We're wondering if you have anything to add to that.
It's a non-issue. Sometimes we want those cytokines to be activated. So some of the research, like on elderberry, some of the research was showing that when you take elderberry and you are exposed to a virus, you're going to get enhanced a cytokine release to activate the immune system to fight the virus. But there's also some studies showing that elderberry reduces cytokine activity when it's to an inflammatory state. I think you could probably make a claim stronger for it. The flavonoids exerting an anti-cytokine storm effect more than a promotion of cytokine storm. And typically, we have these modulating effects of herbal medicines, and I think that comes into play here as well. I don't think it's a real concern. I think sometimes you're going to be recommending the same herb to promote cytokines when they're low, as you are in recommending them when cytokine activity is excessive, and I think that's the case with elderberry in particular.
Oh, thank you. Peter, I think that was a question from you. Is there any follow-up to that you'd like to add, or?
No, I'm just very pleased to hear Michael say that and reinforce, in fact, you know, the opinions of other researchers in the field. I think it was Kerry Bone who was responsible for debunking the myth with regard to echinacea, and Stephen Harrod-Booner, of course, who has his own place in viral research in terms of herbal medicine, particularly, who tackled elder. So, yeah, thank you for that.
You bet. Yeah, I love those guys. They've been great contributors to our knowledge and our understanding, and they express great wisdom. And I think there's great wisdom in the history of herbal medicine.
Great, thank you.
Thank you so much. We're hugely grateful, Dr. Murray. Maybe Peter, you'd just like to say a few words towards the end. I don't know whether there's anything further.
Let me jump on my soapbox one last time to just say a few things to everyone in the UK. I really appreciate your support, and I've really been pleased with the organizations that represent you, and I encourage you to support them as much as you can, because they're doing great things for you, and I really appreciate this opportunity, and hopefully it's the first of many.
Thank you very much, and I will take Gillian's invitation to say a couple of words to finish off. Michael, it's been an absolute pleasure to host you. We're really looking forward to getting this out. We will disseminate this far and wide amongst our members. Hopefully it will also generate some comment, discussion, etc. We in the GNC are very, at the moment particularly, I think one of the things that's come out of this whole crisis is that it's our time to act and be proactive and get out there and start spreading some useful information for our patients, but also for practitioners on the network, so that we all have some kind of network that enables us to share information effectively. So some brilliant stuff here. Thank you very much for joining us today, and we look forward to hosting you again in the future.